Well, welcome back from that Kakaaki social. It's quite intriguing, isn't it? I was just looking forward to those comments. You heard me in the background and said, this is the one I want to listen to. But unfortunately, time would not permit us to get those comments, but you will definitely find it online.
Right. It's the second fortnight, really, the fourth Wednesday in this month, and you know how we do it over here on Kakaaki, the African Voice. So it is cancer awareness in collaboration with the Cormode Cancer Foundation, and the founder and chief executive officer of the foundation, Dr. Denise Ejoh, will be focusing today on Cancer Week, which will be taking place from October 5th to 19th, 2026, here in the nation's capital, Abuja. She will now be joined by her guest. And good morning, Dr. Denise Ejoh.
Over to you.
Good morning, ladies. How are you? Did you do uncle?
It looks like that, doesn't it?
Yeah, it's nice though.
Thank you. Over to you.
I'm good. Take care. Thank you. Good morning, viewers. Welcome to another edition of Kakaaki Cancer. Denise Ejoh. It's nice to see you all in partnership with AIT. I am Dr. Denise Ejoh, as I said, the founder of Cormode Cancer Foundation, and I'm delighted to welcome you all to today's conversation. Cancer remains one of the major health challenges facing Nigeria, but today we want to move beyond simply talking about cancer. So together we fight, we win. Our topic is focused on International Cancer Week 2026, which is holding the first week in October. And we're going to be talking about from cancer awareness to collective action. And that's fundamentally what this is all about. Awareness is important, but awareness must lead to action. Action that encourages prevention, promotes early detection, improves access to diagnosis and treatment, supports patients and families, and ultimately saves lives. So I am particularly pleased to have with me today one of the leaders in the cancer space, who is at the center of the Nigeria Cancer Control. I don't know how they use that. They use a particular term, the cancer people, so they will explain it themselves. So joining me today is Professor Ali Gombe, who is the director at NICRAT, Nigeria Institute for Cancer Research and Treatment. I think I got it. He's the director of clinical services. Kof, did I get that right? Good morning. It's very nice to see you. I've never had you on before.
Good morning, Dr. Dennis. Good morning, viewers. It's National Institute for Cancer Research and Treatment, NICRAT.
National Institute for Cancer Research and Treatment. Yeah, I got it now. I got it. I was just slow. Thank you for joining us this morning. Now, just sit back, let's relax, and let's have a serious conversation on what we expect in the International Cancer Week and how it's going to impact generally on the various things that have been going on in the cancer space, and should hopefully influence what goes on for the next 12 months. Am I right to have said that? Yes, I am. I answered myself, right? So where are we in Nigeria's cancer control response? Where would we say we are, Prof? Let's just begin with that. So I'm looking at 2026, I'm looking at ICW, and I think everybody wants to know where are we today in Nigeria's control, and what are the large urgent gaps we need to be looking at to address. You guys are meeting, or rather the entire cancer community will be meeting at a particular time. So what are the most urgent gaps we must address?
Thank you very much. Where are we? Where do we want to be? Of course, we are not where we want to be, but we have made crucial steps in cancer fight in this country that has never done before. You know, in the past, we don't even have an agency, that implement cancer control activities in this country. So NICRAT was commissioned and unveiled sometimes in 2023, that's about 3 years, which is something great. We now have dedicated budget lines to cancer activities in the country, which has never happened in the past. And also, under the able leadership of my Director General, Professor Usman Manemi, we have swung into action to, first and foremost, do an analysis of which gaps, the gaps that we have in the cancer space, from across the whole cancer care continuum. NICRAT has demanded to take leadership in cancer control activities across the country, in terms of cancer registration, cancer screening, prevention, awareness, diagnosis, treatment, and also palliative care and survivorship. So it's across all the cancer care spectrum. And in each of these very important strategic pillars, we have identified gaps that needs to be, attend to for us to actually move as a country in cancer control. One is that we need data. We need data in terms of where we need to be sure of the numbers of cancer patients that we have. We need to also be sure of the type of the common type of cancers that we have, and also the distribution, based on urban, rural regions, across states, north, south, and all those things, so that we'll be able to plan adequately. And I'm happy to say that so many things have gone through that, most especially in cancer registration, from trainings to, upgrade of cancer registries. And as we speak now, Nigeria is already planning to launch its first cancer body report of 2024, which will be launched very soon, and most likely in International Cancer Week. So at least this data will be able to allow us inform policy and also take a strategic direction, in the right direction, and steps in the right direction, so that we'll be able to attend to what is actually our problems. Of course, the other aspect is in terms of awareness. There's a lot of myths, a lot of misconceptions, in terms of what cancer is, what causes it, whether it's curable or not. That's also a very hot debate. Whether you need to go to the hospital or not, there is even you need injection to treat cancers or not. So a lot of problems, in terms of that. But we have launched awareness campaigns across all 36 states in all aspects of cancer care, but focusing mainly on the common cancers that we have, from radio jingles to television adverts to even community awareness campaigns, engagement of community leaders. So many activities are going, and these are also in partnership with many stakeholders across the country, most especially the non-governmental organizations involved in cancer care. With people like you, most especially, we have been doing so many things to take this message to the population. And we are also aware that, when we came in, that there is also a need for a coordinated approach to cancer screening, most especially for common preventable cancers that we have in the country. Nigeria before now has no any coordinated cancer screening program, and most of these activities happens in silos. So there was need to actually have some level of coordination, and also high government endorsement and presence, and also commitment into those cancer screening programs, which is what is currently ongoing. That has given birth to the Preventive Oncology Clinic, which was launched during the World Cancer Day this year, specifically on the 4th of February 2026, whereby the Honorable Minister of Health launched the FMCG, the Preventive Oncology Clinic, but at the same time, concurrently, additional other 7 centers across the country were also launched, bringing it to total 8 preventive oncology clinics. What is that preventive oncology clinic? It's actually a novel, project whereby anybody can just walk into the clinic and ask for screening of the top 5 common cancers that we have in this country. And this is already ongoing, and NICRAT has deployed equipment and also some training, and we're doing this in collaboration with teaching hospitals and federal medical centers that this program is domiciled into. However, the Preventive Oncology Clinic is also going to have a community arm,
Sorry, okay. Prof, I need to stop you here because there are some things I have to ask you now. Now. Yeah. Okay, so now let's start with one of the things you have talked about, the awareness campaigns, and yes, they are very essential. And just a very quick, because I have 3 questions based on what you just said. Now, I want to take them in the order of simplicity. So, based on the awareness campaigns that are now out, you just mentioned the billboards and the jingles and all that. Now, how is it going to be sustained? And it's not something that I can say that a lot of cancer patients are fully aware of. So, where are there some states, for instance, that are not getting access or can't hear or can't are not able to know that these campaigns are out there? And what cancers? You said there are 5 cancers. What are the 5 cancers? Because there are other cancers, and so which are the 5 that are being addressed, so that those that are not being addressed, I would want to know what is the plan for them.
Okay, thank you very much. We understand that the awareness programs, we need to take it to the subnational level. So the NICRAT or Federal Government Ministry of Health cannot do it alone. And that is why we have actively engaged, most especially the Nigerian Governor Spouses Forum and also the First Ladies Against Cancer, who are very much interested, in cancer awareness and screening and other control activities around cancer. And this has led to several activities that are ongoing that we have done all in partnership with state governments, and also planning to do, so that these messages we can drive from these messages to the local people at the state level. There is need for actually, state buy-in for most of these policies and programs that we are creating, so that it reaches the population, the target population, which is mostly the rural dwellers, which are more than the urban dwellers. So for example, let me just give you 1 or 2 examples. We had under the National Task Force on Cervical Cancer Elimination, which was a committee inaugurated by the Honorable Minister of State for Health, to which secretariat at NICRAT, to address the WHO target for cervical cancer elimination by 2030. And so we have been partnering with First Ladies to drive cervical cancer awareness screening across the states. And recently we had one in Imo State, for example, whereby screening programs, in collaboration with the state government, the National Task Force, NICRAT, and also was done, across the states. And
okay, Prof, I hear all that one, but that's not, me now, that's not where we are. So let's talk about the cuckoo. Okay, so the main thing I'm going to ask again is the next one I want to ask is, therefore, cancer patients are not accessing treatment. No, that's not, let me put it correctly. The funding is available, the drugs are not available. Let me put it correctly. The funding is available, so I'm not going to question the fact that CHF is not available. I agree. There's money in the wallet. The challenges cancer patients are having are accessing the drugs. Yeah, that is the challenge that we're having now. Is there a way, or can I put it forward, or I don't know if what is being done to make sure we can get it? Because if we can raise the money and yet we can't put the money anymore in the wallet, because where we used to put money in the wallet and you guys put money in the wallet for cancer patients, which is awesome. Thank you very much. Now, even if the money is in the wallet, we can't get the drugs because it's not being sold via the wallet anymore. So how are you guys going to address that for us, please? Okay,
like I mentioned, despite how successful and also the beauty of the program, it's not devoid of challenges. We understand one, when there was that many multinational companies that supply these anti-cancer medicines are pulled out of this country, and that has created a vacuum, in the sense that they used third parties now to supply these anti-cancer medicines. So that vacuum actually created some delay, and then also with the fluctuation of the dollar, they were also reluctant to actually supply into the program, because they are not sure when they bring it in, after selling the anti-cancer medicines, when they go back to the market again to get another one, to import another one, probably the price will have doubled by then. So they were also reluctant to do that. The other aspect was also the issue of the programs that the hospitals that these programs were also domiciled in. A lot of reconciliation issues and other things that have occurred. So what have we done? The first thing is to look at the most importantly, which is the rate meeting step for import, which is the dollar to naira rate. So we now advise, we had a committee that meets every two weeks. It's called the CAP Optimization Committee. It meets where it comprises of the government staff, Federal Ministry of Health, NICRAT, and stakeholders such as the Oncology Pharmacists Practitioners Association of Nigeria, and also the pharma companies and distributors are also part of the committee. Every 2 weeks, we sit down and review the program and see what are the challenges and how to overcome them. So with respect to that, we now decided that drug companies should cut, their prices for 6 months, and then we give them LPO to supply into the program for 6 months, so that after 6 months, we will now review based on whether the dollar has gone up or gone down, so that we can approve for adjustment of their prices. That will be able to mitigate, and I think we are going to see some results now, as some of these drugs are becoming available back into the system. The other aspect is also that we have tried to also look at the long-term solutions to these programs. Long-term solution to this program is actually local manufacturing of these drugs. We have currently engaged PBAC, which is part of its mandate is actually to encourage local manufacturing of medicines, including anti-cancer agents, and we're looking at how to actually come up with initiatives that can, in partnership with PBAC, that can assist in having these drugs manufactured locally. And then we also are talking to our sister agencies, because another problem that we also observe in the program is the regulatory bottlenecks. These programs, the drugs are brought in at 50 to 60% discount, compared to the parallel market price. So there is need to have some also incentives, not necessarily, doing the right thing, but at the same time, giving them some relief, so that they'll be able to encourage them to, bring those drugs into the system. And we have engaged NAFDAC, we are working on that also to make sure that waivers and other, things that are required necessarily are done in good time, so that these anti-cancer medicines are brought that. And just recently, we are about to receive also donations of a very large quantity of anti-cancer medicines. So, and I think on the short term, this will also bring some relief as we try to rectify the problems. Some of these drugs are come free. We will just distribute them based on the needs of the cancer patient.
Okay, Prof, you know what, you've actually addressed so many things, and we're coming to ICW now. So now ICW, when I see you in ICW now, I'll be able to come back and ask you the same questions and see how far we've got. Okay, so we're rounding off now. Let me just ask you one last question, and that's the end. In as little as 2 sentences, what are we expecting in ICW? 2 key things that we're expecting in ICW, and that's it. I'm done for today.
Did you say ICW?
Yes, this is ICW. Yeah. You've talked about everything NICRAT is all about. So just 2 things that we should look out for in ICW that's going to make it very special this year. Yes.
Yeah. This year we are trying to actually make it truly international, and you see a lot of international participation in the ICW. And also, the technical sessions are extremely rich, and so that we'll be, at the end of the day, we'll be able to have a communique that is also very rich, and we'll be able to, going forward, implement, and that to inform us also in how to improve in the policies and implementation of cancer.
Thank you very much, Prof. I've put you on the spot on a lot of things this morning, but I really appreciate your honesty and the fact that at least cancer patients know that there's some hope in our drugs coming back into the market, because honestly, that has been a very big concern. And to all those that have supported you and all the NGOs across Nigeria, well done. They're all doing the world fantastic job. So thank you, Prof, for joining us this morning. Prof, as we come to the end, I've finished now. Cancer cannot be addressed by government alone. It requires partnerships between government and healthcare professionals, between institutions and communities, and importantly, between the healthcare system and the people it serves, and that is the patient. So thank you, Prof, for joining me this morning to talk about it. And as we get ready to close, I have a message for you. And to everyone watching, remember, cancer awareness is not the destination. It is the beginning of an action. Know the risk factors. Pay attention to changes in your body. Seek medical advice when something does not feel right. Encourage your loved ones to do the same. And let us all play our part in building a Nigeria where cancer is detected early, care is more accessible, and no one has to navigate the cancer journey alone. I am Dr. Denise Ejoh, the CEO of Cormode Cancer Foundation. I want to thank you, Prof, for joining, and let us see you soon, very soon. God bless you. Have a lovely day. You can follow us on our social media. Thank you, Prof.
Thank you.
Indeed. Thank you so much, Dr. Denise Ejoh and Professor Usman Malami Aliyu, for rich insights right there. Over here, we listened and we're looking forward to all the conversations that will be had that Cancer Week come October.
Yes, indeed, and I think that in following up, I just would like to commend Dr. Ejoh for her consistency and pushing this advocacy forward. Due to this program, a lot of people have had a lot of insight on cancer care and, of course, palliative care for survivors as well. But away from that, we move straight to entertainment and lifestyle.